Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on leflunomide tablets, exploring the various aspects of leflunomide, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of leflunomide tablets. Leflunomide tablets are commonly prescribed for the treatment of rheumatoid arthritis, a chronic inflammatory disorder that primarily affects the joints. It belongs to a class of medications known as disease-modifying antirheumatic drugs, which work by suppressing the abnormal immune response responsible for inflammation and joint damage in RA. Next, dosage of leflunomide tablets. The dosage of leflunomide tablets typically depends on the severity of the condition being treated and individual patient response. However, a common starting dose for adults with RA is usually 100 mg once daily for the first 3 days, followed by a maintenance dose of 20 mg once daily. The dosage may be adjusted by the prescribing healthcare provider based on the patient's tolerance and response to treatment. Next, discuss mechanism of action of leflunomide tablets. Leflunomide works by inhibiting an enzyme called dihydroorotate dehydrogenase, which is involved in the synthesis of pyrimidine nucleotides necessary for DNA replication in rapidly dividing cells, including activated lymphocytes. By interfering with this process, leflunomide reduces the proliferation of immune cells, particularly T lymphocytes, and suppresses the abnormal immune response responsible for inflammation and joint destruction in RA. Next, side effects of leflunomide tablets. While leflunomide can be effective in managing RA symptoms, like all medications, it can also cause side effects. Common side effects are gastrointestinal disturbances such as nausea, diarrhea, or abdominal pain, elevated liver enzymes, which may indicate liver inflammation, hair loss, headache, and rash or skin reactions. Then serious side effects, although less common, may include severe liver damage or failure, bone marrow suppression leading to decreased blood cell counts, and interstitial lung disease, causing breathing difficulties. It is important for patients to report any concerning side effects to their healthcare provider promptly. Next, important advice for using leflunomide tablets. Patients taking leflunomide should undergo regular monitoring of liver function tests and blood cell counts to detect any potential adverse effects early. Leflunomide can cause birth defects if taken during pregnancy. Therefore, it is essential for women of childbearing age to use reliable contraception during treatment and for a certain period after stopping leflunomide therapy. Patients should avoid or limit alcohol consumption while taking leflunomide, as it may exacerbate liver toxicity. Patients should consult their healthcare provider regarding vaccination schedules, as certain live vaccines may need to be avoided while on leflunomide therapy due to the immunosuppressive effects of the medication. Leflunomide can interact with other medications, including certain immunosuppressants and hepatotoxic drugs, so patients should inform their healthcare provider about all medications they are taking. Patients should attend regular follow-up appointments with their healthcare provider to assess the effectiveness of treatment and monitor for any potential side effects. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking leflunomide tablets. Remember, knowledge is power, and being well-informed empowers you to make the best decisions for your health.